Suffering with back pain, I want you to understand that a lot of people don't realize what the number one cause of most people's back pain is. And so I want to talk about that with you today for a couple minutes. So it's great to have you here, everyone. Make sure you say hello. Welcome if this is your first time or if this is your 100th time plus. Welcome back. It's great to have you part of our family. So unfortunately, I didn't charge my iPad up, so my iPad's charging up right now. So I had a whole little fun presentation together for you. So we're just going to go without it today, and I'll show you some models instead. So the number one cause, believe it or not, of back pain is actually compression of the spine. And what we mean by that is when our spinal column is nice and healthy, we have these structures right here called the intervertebral discs. Their job is to act and create a spacer so that the bones can be pushed apart like this, and so that there's plenty of room for this nerve, your nerves that come off of your neck or your low back, to get down to your arms, hands, or fingers, or down into your buttocks, legs, or feet, and also to your organs as well that come off of there. And when the spine degenerates, and I'll show you, this will probably be kind of a cool little model right here for you. So when we go from this, where you have nice healthy discs, to discs that start to become compressed, to discs that become even more compressed, to discs that are severely compressed, what winds up happening is it usually creates more compression to the nerves. And so I'll show you that difference here in a close-up. See if I can maybe bring this in for you on this camera. And so when we look at a nerve, let me just flip this around real quick. All right. So if you look at my model right here, what you can see is you're seeing the nerve branch right there that's coming off. And I'll get a little pointer here. And a healthy nerve should be that thick. All right, so hopefully you can see that. So when you have a healthy disc space and there's plenty of hydration to the disc, it pushes the bones far enough apart that allows these nerves to have plenty of room in that hole that they're coming out of, because what they're doing is they're branching off of your spinal cord. And so here's your spinal cord right here. And then you have a nerve branch that branches off to one side and off to the other side. And so when the disc is nice and healthy and thick, there's usually plenty of room for the nerve to get out. If the disc starts to become thinner, like you see in this model, then what starts to happen is this space where this nerve is coming out starts to become reduced. Usually at this point, it's not going to cause you a lot of issues. Most people don't know that it's happening yet. It's usually asymptomatic, but you can see the difference in the disc height. So look at the difference in the height of these discs. So you can see how this one right here on this side is thicker than this one is. Where you really start to notice this problem at is when you go into phase 3 of this, which is now you can start to see a dramatic change in how these discs are functioning and how they look. And so now when you compare a healthy disc to a diseased disc, there's a big difference, right? And I want you to start to see, now you'll start to notice a big change in the size of the hole for this nerve to come out. And I want you to start to look at this nerve. So when a nerve gets compressed over a period of years, it does a thing called creates nerve atrophy. Nerve atrophy means that it's actually suffocating the nerve of blood supply and oxygen, and as a result, the nerve is starting to die. So look at the difference in the size of this nerve right there. You can see how thick this nerve is. And then look at this one that's in a state of disease. See the difference in the diameter? So when you start compressing a nerve and this nerve starts to become diseased, that's usually when you're going to start getting discomfort or radiation of pain or numbness or tingling or weakness. And if it continues on over a period of time, you can eventually, your nerve can start to look like these. And we don't want them looking like that because they're dying at that point on you. And when they start dying on you, the body will usually give you very common symptoms of numbness, tingling, going down your arms, hands, or fingers if it's in your neck, or down into you'll have low back pain or radiation down into your buttocks, legs, or feet, or weakness. Sometimes you also see changes in organ function. Start to know a change in your urinary function. Maybe you have to pee more often, or you can't control your urination properly yet. And so you're having issues like that. And so I want you to see the difference in a healthy nerve and a very diseased nerve. See that difference in that yellow fiber? So we don't want you winding up like this, okay? And so what do you do about that? Well, that's a great question. And I'm glad that you asked. So I'll flip you back over to my camera here and let's see if I have enough. Still at 3%, so I won't be able to show you the slides. We'll have to do it next time. Spinal decompression for people that are having symptoms of compression in their spine is probably the number one tool that you can use if you are looking for a non-surgical approach to managing your disc pain or your back pain. Spinal decompression takes a spine that might look like this and starts to create that space again. Okay? And over a period of time, and 12 weeks is usually pretty much the magic formula for it, is as you go through a process, you lay on a table, and this table very gently starts to create a little more space. It holds the vertebrae apart a little bit and then allows it to come back a little bit and then lets you rest and then does this hold again and then relax. And what that's doing is it's actually creating a pumping mechanism back into the disc so that the disc can start to suck blood back into them, get more oxygen into them, get more nutrition into the disc, and then push out their waste products. So that's how it works. It's like an accordion. You know, you see those guys playing the accordion, you know, at a fair and stuff, like the music's really cool. So the only way that that accordion works is from air movement being pulled in and then pushed back out. Our discs are exactly the same. So when we see discs in our spine that are working like this, we know that that pumping mechanism, that separation and pull and push onto those discs to pull in blood, pull in oxygen, pull in nutrition, and push out waste products is happening properly. When we start seeing discs like this is usually where most people are calling me at, is when they're getting that type of disease level. We know that this isn't happening. And when you look at an MRI, you can actually see it on your MRI, is that these discs, when they're healthy, they have a very bright white to gray color to them. When they're diseased and they're getting no oxygen and nutrition, they turn black. And so these models are very realistic on what happens in our body. So we don't want, if we start seeing your discs on your MRI from the side view starting to get darker or black, you know that that pumping mechanism has stopped or has dramatically reduced. So one of the most important things you're going to want to do is you want to start to get that process to start to function again for you. It's adamantly important because you can go in and you can cut out a bad part of a disc and you can take pressure off of a nerve temporarily. But just remember, you still have diseased tissue inside your body. So if you're a person that's a biohacker, if you love doing everything you can to keep your body healthy, then you're definitely going to want to incorporate spinal decompression into your program of biohacking. If you're a mom that just unfortunately can't go and do the normal things like go to the grocery store and shop because you're in pain, it's hard to bend over and wash the dishes because you get stuck in that position. You want to hold your baby, but you start thinking like, oh, I know if I do that, it's going to kill my back. So you don't, and your heart breaks. Maybe go into Lowe's or Home Depot and go and getting flowers and stuff, right? And plant them in your garden, in your yard to make your yard look nice. And you want to do it so badly because it brings you joy. And you know that if you do it though, that your back's going to be killing you. I want you to know that there's a lot of ways of managing spinal pain without surgery. But if you go to an orthopedic surgeon, most of them are going to tell you that you need surgery. You're going to see a lot more fusions taking place where they start to screw and bolt your bones together. And once they do that, you can never do decompression again. So I always suggest to clients, if you're in a position where you're having any sort of degenerative disc disease due to compression, go do spinal decompression. Make sure if you go find a doctor that's in your area, make sure they're nationally certified though in it. Not someone that just bought a machine and they learned how to use it from their salesperson that sold it to them. But make sure they're nationally certified. There's a couple organizations in the United States that do national certifications. I've been nationally certified 6 different times just because I love this stuff. I've seen the miracles for people in their lives. And if you're suffering with this or someone that you love is suffering with back pain, most of the time they don't have to do that. Most people are just unaware that this therapy works. So make sure you do that. Ask for people and make sure that they take MRIs. Super critical. And pre-MRI and post-MRI after a 12-week period, because if you're getting your body to heal, you should be able to see the difference in a post-MRI. And if you've been with me long enough, you know I've shown you lots of pre and post-MRIs. So make sure you do that, okay? If you what else do you want to do? Make sure that they show you amazing testimonials of people. They should be able to show you pre and post MRIs of different clients as well after they go through this process. Those are things that you're going to look for. Have they won any awards for doing decompression in their community or through the chiropractic society or medical society? If they do, that usually tells you that they're doing pretty awesome work as well. And do a lot of people go there? Do a lot of your neighbors go there? Your friends go there? Those are important things. If you can't find someone like that, I want you to reach out to me because we've created a course that you can do spinal decompression from your home with a very high success rate. Our clients are all over the world and actually doing quite phenomenally well. You know, my gentleman in Indonesia, you know, he was in back pain all the time after doing our program. He's out hitting golf balls again, which is all he wanted to do. And I got a gentleman in Hawaii, same thing, you know, he bowls and just, you know, he could barely walk for 1 to 3 minutes. And now he's getting ready to go on a trip to Japan. You know, I've people that sew and do all kind of stuff all around the world, you know, and they're able to get back to the things that they love to do. And do it without surgery and without hardware in your spine. And don't forget the whole cost of that. So I want you to know if you have someone that's suffering with neck or back pain, usually decompression or compression of the spine is the #1 cause, and there's a tremendous amount you can do about fixing that without surgery and without living on drugs for the rest of your life. And if you have questions about that, I want you to reach out to me. You can DM me if you would like, and just put in back pain, and I will reach out to you. And if you'd like, we can set up a call together and see if I can help you. And if you have an MRI, I would love to help you understand your MRI more, and so see if a non-surgical approach could be a tool that you could use to get your life back and start being the mom or dad or grandparent that you want to be, and get back to the things that you love to do. Okay, so I hope this has been valuable. Sorry I didn't get to you didn't get to see all the slides today that I made for you, but we'll have to do it again because I made some really cool ones. Unfortunately, I totally forgot to plug my my iPad in, so you didn't get to see them today. But next time we'll show them to you. So I appreciate everyone. Just remember, you don't have to live with back pain. You really don't, and you don't need surgery for most conditions. So reach out to me. I'd love to help you. Okay, and appreciate everyone being with us today. I hope you all are having an amazing day. It's another gorgeous day here in Georgia, and I appreciate you so much being part of our family. And I'll see you next week at 1 o'clock. Hey, Steph.